It's Jay, the insurance guy, and sometimes your insurance is only as good as your agent. Now, I'm gonna make this really quick. If you care about cancer, you need to watch this. If you don't, then don't waste your time. Okay, it's really simple. Now, we've already talked. Nick, I know you care about cancer. If it happened in such a way that you understand everything that went along with fighting cancer, then you know exactly where I'm going with this presentation. Business owner or having employees, just everything. It can bring so much pressure on you or your family because it's never just one person that's affected. It affects the whole family. So I'm going to go over our coverage, and it's not like the normal major medical coverage. As you already know, that money goes directly to the doctors, directly to the hospitals. This is actually it just helps take the pressure off of you or a family member if someone was diagnosed with cancer. And this is called our Cancer Aid Plus. Let's get straight to it. First of all, some quick statistics. The statistics to today, according to the American Cancer Society, nearly 1 in 3 women, more than 1 in 3 women is going to be diagnosed with cancer in their lifetime, and more than 1 in 2 men, according to the American Cancer Society. And there is good news. The 5-year survival rate is up to 69% because of early detection as well as treatments. And whenever those things happen, the thing that people forget about are the non-medical expense, because those insurance policies, the major medical insurance policies, they're not going to meet you at the gas pump, which they really need to meet you at the gas pump. These days, they're not going to meet you at the grocery store to help you out with new diets. They're not going to meet you at your business to sub you out so they can work for you, or the things that you need. They're not going to be there to do that. They're going to pay those medical and hospital bills. And this is whenever a cancer policy comes into play, and it's really great. And our heart policy works the same way. I'm going to show you the cancer. First and foremost, the first thing that's going to happen is whenever you're diagnosed with cancer for the first time, you're going to get a lump sum benefit. This is our level 5. We do have other benefit levels. I'll go over those at another time. $7,500 for the first diagnosis, and then there's a reoccurrence benefit. Sometimes cancer does and will come back. So after 5 years cancer free, you can also get half of your original first lump sum benefit if cancer does come back. There is inpatient benefits with no lifetime maximums. That is huge. Inpatient hospital benefit is $1,000 per day for days 1 through 90. There's an extended inpatient hospital benefit as well for days 91 through 180 is $2,000 per day, and anything over 6 months is $2,500 per day for up to $75,000 per month. The ICU benefit is $1,500 per day, or $1,250 per day, $1,250 per day for subacute ICU. Attending physician is $200 per day. Private nurse, $200 per day. Skilled nursing facility and extended care facility, $300 per day. Observation unit, $300 per day. And also a hospice benefit of $250 per day. And there's more. These are the surgical benefits, and they have no lifetime maximums. Also, the benefits are payable for experimental FDA-approved treatments, because treatments are going to be advancing. So eventually, we're going to go ahead and make sure that cancer is taken care of, and hopefully there's going to be a cure very soon. Also, the surgical benefits are going up to anywhere from $500 to $25,000 depending on the surgery. A skin cancer is going to be different than a major surgery. Anesthesia is $6,250. Second and third opinion is $600 per opinion. And these are the therapy benefits most likely what people use to fight cancer. $35,000 for the first bone marrow transplant, and $10,000 for the second bone marrow transplant. Also, for a stem cell transplant, it's $10,000 for that. And then there's also other cancer treatments that are most frequently used, radiation and chemo. $625 per day for up to $50,000 per year as well. And with chemotherapy, sometimes there is some complications and pain upon the body. The body can really drain the body. So there is anti-nausea and pain medication that's built in to our plans to up to $30,000 for a lifetime maximum. And this benefit is payable even if the medical facility administered cancer treatment benefit pays at the same month. So the anti-nausea and the pain medication can both pay at the same time. Also, immunotherapy and hormonal therapy for up to $24,000 for a lifetime maximum as well. Also, we have travel benefits that have no lifetime maximum as well. And maybe you've experienced this. This is a big one, I do believe, to help put money back into your pocket at this time when gas is just way high. Travel every way is really high. Ambulance benefit is $1,250 per one-way trip. If you decide to drive to your treatment facility, it's 75 cents per mile for you and a family member. If you decide to take a plane, train, or bus, it's $5,000 for you and a family member per round trip. If someone decides to stay overnight, it's $100 per day. And then also there's a wellness benefit that has no lifetime maximums, and there's a $100 per year wellness screening, which everyone should definitely take advantage of. These are riders you can add that goes up to $30,000. And the way it works is you get diagnosed with cancer, you can add up to $30,000 for your lump sum. It also has a reoccurrence benefit like your initial lump sum benefit that I showed you on the very first page. Also, there's a critical conditions lump sum rider that goes up to $30,000, and that will pay you upon a major organ transplant, paralysis, blindness, coma, Alzheimer's, as well as diabetic amputation, deafness, or end-stage renal failure. This is our cash value benefit, and it works this way. It's benefits when you need them, in cash when you don't. Let's break it down really quickly for you, Nick. Let's say you pay so much in premiums, you never had a claim. That's what I want. I don't want anyone to ever have cancer. You're going to get 100% of your money back. Now, let's say, for instance, you pay X amount of dollars. You have a small claim. You'll get the difference of your claim and how much you paid in. And let's say you have a large claim. You pay so much in, but your large claim is $250,000, $500,000. Doesn't matter what that amount is. If it outweighs how much you've actually paid in, then you don't get anything back. But guess what? The policy did exactly what it was supposed to do, and that's to take the pressure off of you and your family if someone was to be diagnosed with cancer and help you in that time of need. So it's benefits when you need them, in cash when you don't. The cash value works after 6 years. It starts building cash value until it reaches that full maturity point. And anything in between 6 years and its full maturity, you'll get that money back to your beneficiary, your trust, or your estate. And it's based on where you are in that period of time of how much money you'll get back. But it's a great cash value benefit that we have in our policy. It's benefits when you need them and cash when you don't. Now, here are the advantages of your Cancer Aid Plus policy. The benefits are going to be paid in cash to you, whoever you choose. The benefits are going to be paid regardless of any other insurance you have. Your benefits are not going to be reduced, or not, that's a better way. They're not going to be reduced to you as you get older. As well, it pays for your whole family. Even if you add newborn children, it's not going to be an increase in price as well. And the price is not going to increase just because of your health or because of your age. And it's guaranteed renewable for life. You have a family to protect. It takes the pressure off of you. It's going to be one of the best decisions you've ever made, because if you never use it, you get all your money back. But let's just say something does happen, you're going to know that you're going to have what you need in place to help get you through this hard time. And then afterwards, I guarantee you're going to thank me for seeing you. And I hope that I explained everything. It's the best way I could. It's what I do. I try to do the best thing I can for you. And I hope to hear from you soon.